field workers in hot environments have to do with CKD cats? Believe it or not, quite a bit. If you're new here, welcome. I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the video so I can create more content like it. It's a common misconception to assume that a cat with chronic kidney disease is well hydrated. After all, they're drinking a ton, they're peeing a ton. That must mean they're well hydrated, right? Well, not quite. You see, as kidney disease progresses, the ability of the kidneys to concentrate the urine or draw water back into the body is lost. This makes dehydration an incredibly common and detrimental complication of CKD in cats. Dehydration can lead to poor appetite, no appetite, lethargy or just not feeling good, and even constipation. It can also lead to weakness and set cats up for a uremic crisis. Dehydration may also increase the likelihood of stone formation and urinary tract infections. On the flip side, as kidney disease progresses, the ability of the kidneys to excrete water from the body is also lost, and overhydration can be another complication. Let's go back to those field workers I mentioned earlier. Last weekend, I had the honor of attending a feline-only veterinary conference and was able to learn from the one and only Dr. Quimby. Her and her lab are at the forefront of all things kidney disease research and cats. She described a syndrome called Mesoamerican Nephropathy that occurs in field workers in hot environments. An abnormally high rate of chronic kidney disease was seen in these young men that are constantly exposed to hot work environments and dehydration. Many researchers believe this syndrome in young men is most likely due to that chronic field work, the chronic heat exposure, and the chronic dehydration, which is causing insults and minor damage to the kidneys over time. Essentially, this syndrome in field workers is believed to be the same thing that may be contributing to chronic kidney disease in cats. While we haven't pinned down one exact cause to chronic kidney disease in cats, if you haven't watched my video on the causes of kidney disease in cats, check that out. But while we haven't pinned down one exact cause, it is believed that acute kidney injuries multiple times over time will predispose a cat to chronic kidney disease later in its life. Things like urinary tract infections, stones, low blood pressure, and dehydration all predispose the kidneys to these small acute kidney injuries. The more often these small injuries happen to a particular cat, the more likely they are to have chronic kidney disease later in their life. Recognizing dehydration as an actual disease and treating it therapeutically, essentially a prescription for water, could go a long way in preventing or delaying the progression of chronic kidney disease. The body has a really long list of checks and balances to maintain normal, and it will fight really hard to maintain that normal state. These checks and balances are great in the short term. They do what they're supposed to do. They take an acute state or a disease state, throw in the checks and balances, and return the body to a normal state. But when you have a chronic state where there is constant activation of these checks and balances, it can actually cause negative effects. Things like vasopressin and the RAS system are required for life. But when they're constantly activated, they can cause high blood pressure, they can cause protein loss in the urine, and they can cause fibrosis or scarring of the kidneys, which obviously is not good for them. All of these not so great changes can be triggered by dehydration. So what is the treatment, so to speak? Keep those kidneys hydrated. This is an incredibly important conversation to have with your veterinarian about your cat. What does hydrated look like for your cat? There's something called a skin tint test. It's not perfect as it can be affected by many variables, including weight, body mass, fat, and other things, but an abnormal test is usually pretty abnormal. So getting to know what your cat's normal skin tint looks like can be a very valuable tool in the long run. There are also blood values that we can check that help us know if a patient is hydrated or not. It can also be helpful to monitor the size, quality, and frequency of your cat's bowel movements. Did you know that fecal scoring charts exist to assess the quality of your cat's poop? Yep, we definitely talk about poop a lot in this profession. In fact, I just had a client the other day ask me, do you know how many times you guys say poop in one day? All joking aside, a healthy, well-hydrated cat should have a bowel movement at least once a day. With the invention of smart litter box devices, Obtaining this information can be a lot easier. In the face of CKD and mild dehydration, the body starts to pull water from the colon to account for what it's losing in the urine. This leads to drier stool, more difficult bowel movements, and even sometimes constipation. It may sound gross, but become obsessed with your cat's stool quality and frequency. It can be a window into their health. Okay, we have a video crasher. He wanted to come say hi, so I told him that he has to come say hi on video. Ask yourself, how often does my cat go? How much time do they spend trying to go? What's the degree of difficulty? Are they going back and forth to the box, or are they going once and having a bowel movement? Are they straining? Is there any vomiting associated with defecation? Are there fecal pellets found throughout the house just randomly? Where's the litter box located? Is it easily accessible in the case of arthritis or weakness? Senior cats shouldn't have to travel far to use their litter box, or use stairs, or jump into or onto things. The box should be cleaned at least once a day. Bonus points if you are cleaning it twice a day. You wouldn't ask your grandma to climb 2 flights of stairs to use a dirty porta potty, would you? I hope not. Arthritis can make bowel movements more difficult, as can a low blood potassium level and the use of phosphate binders. Some cats have motility disorders as well, and that means that food digesta isn't moving through the GI tract like it should at a normal pace. All of these things, including dehydration, need to be addressed and balanced to successfully manage constipation. Oftentimes we're using things like potassium supplements, stool softener, fiber supplements, and motility drugs like cisapride when constipation pops up. But none of this is going to be very effective if the cat's not taking in enough water and remaining hydrated. Feeding canned food instead of dry food, or adding water to dry food, may help increase water consumption. Ensuring there are multiple fresh, clean water sources throughout the home can also help. These water sources should be cleaned daily, and accessibility to those should be assessed as well. Think about your arthritic grandmother again. How many hoops would you make her go through to get a drink of fresh, clean water? Your senior, potentially arthritic cat needs to have multiple sources of fresh, clean water if you want them to drink it. Some cats find new sources of water intriguing, so adding multiple bowls throughout the house, random mugs or dishes may intrigue them enough to get them to drink more. Some cats like it if you even add ice cubes to the water. The best source of hydration is physically drinking it or supplementing it through a feeding tube. All of the fluids that we use for subcutaneous administration contain some degree of sodium to them. And there really aren't great studies to assess what that sodium load does to our cats with chronic kidney disease. The more your cat will willingly drink on their own, the better. One additional complicating factor to keep in mind is that cats are actually pretty ineffective at drinking. The amount of time it takes them to drink something versus what they actually take in is pretty sad. Products that increase the viscosity of the water may make drinking more productive and go a long way in keeping our CKD cats hydrated. These are all strategies for daily normal life. But what happens when normal life changes? What happens when you have guests over? Or there's loud things happening in the neighborhood like fireworks? Or there's an anesthetic event? What if your cat gets sick with vomiting or diarrhea or another illness that is going to make water consumption even more important because they're losing it through other bodily fluids? It's important to consider that in these scenarios, you may need to provide more supportive care for your cat than you would have had to when they were young and healthy. During these scenarios, if we can provide hydration more quickly and efficiently, it's possible that we may avoid all of those small, tiny hits to the kidneys and again, delay the onset or progression of chronic kidney disease. With anesthetic events, it's important for our cats to be hydrated before the event, during the event, and after the event. Anesthesia can come with some side effects. It's very possible for cats to develop vomiting or diarrhea secondary to the anesthesia, nausea, vomiting, lack of appetite. Those are all possibilities. So we need to keep this in mind and support these cats in the period after anesthesia. These side effects don't happen with all cats, but if they're happening with yours or there's a possibility they may be happening, definitely have a conversation with your veterinarian about what are we going to do for nausea, what are we going to do for fluid support, so that you have a plan in place, or if you see them happening, you jump on them right away. On the flip side, overhydration can have negative effects as well. Fluid may build up in places in the body it doesn't belong and have detrimental effects on the kidneys. Studies have shown both in mice and humans that fluid overload is associated with poor outcomes. Hydration and overhydration and dehydration really is a very delicate balancing act, but it's one we should strive to get good at. As with all things medical, studies are ongoing and our answers may change, but hydration is a big piece of the CKD management puzzle. Water balance will physically make a cat feel better, and it will help their internal organs, especially their kidneys, function better. Hydration is part of the clear, systematic roadmap that is the best way to manage CKD cats. If you don't have a roadmap in place, a specific roadmap to your cat, my course, the Feline CKD Roadmap, may be just what you need. Sign up to receive updates about the course and my free PDF, 5 Mistakes to Avoid When Caring for Cats with Kidney Disease, below this video.